Hello, thanks so much for tuning back in. So this week, Kibby and I are going to talk about something we've actually been wanting to talk about since the beginning of this podcast, which is basically how to find a therapist, what therapy is like, what we ourselves as therapists are thinking, kind of just general questions about the process. And this has really come to light because if you are in Bachelor Nation, you may know about what was going on with Taylor Nolan and her Twitter from several years ago being exposed. And we don't need to get super into that, but basically a lot of things were said that made people very afraid to get therapy. Some public comments about her clients and their appearance and certain populations of patients where really, really horrible things were said. And so we just wanted to address that. I know there were a lot of people who became really afraid to get therapy because of that. And that was really sad for me to see because I don't want anybody to be afraid of bettering their lives or afraid of living their own, or afraid of it sort of enhancing their own lives, living a better life, living a life that they're more excited about just because one person tweeted a bunch of shitty things. So we are going to address those tweets and kind of talk about this from the frame of what it's like to be a therapist and answer a lot of questions and concerns that you all DM'd me with in light of these tweets. Because I know, just to kind of touch on her tweets, I know that it was concerning. It sort of presented this possibility that the therapist is judgmental and secretly kind of has this whole other perspective on therapy that they're not sharing at all. And it is incredibly vulnerable and scary to seek out therapy and tell a stranger things you've never told anybody else before. And it's really disturbing and scary to think that that person could be judging you on the other side and that they don't have their best interests in their heart and they don't have compassion for you. And so, we just wanted to kind of speak vulnerably about our experiences and your concerns, and they're valid. What do you think, Kibby?
Yeah, I think even besides for Taylor Nolan, who was on The Bachelor, and I do think that a lot of people have asked me over the years, how do I know if I'm seeing a good therapist? Especially if it's, starting out therapy. What most people do is kind of look on Psychology Today or Google, and they find a therapist who has an availability, and then they jump into therapy without knowing, how to really look for one, or what they should be looking for, or what's a good therapist, what's a bad therapist. So people go into this process blind, and there are some kind of guiding principles to, how to be informed, how to find a therapist that works for you, to kind of understand what the process is like. And it's very different from any other time in our life because now therapy, now people can just Google people, right? Like people look you up on Facebook, they could Google you. So I think in the past when therapy, in the heyday, it really was a blank slate. You come in, you know nothing about this person. And these days you can actually find out quite a bit. So it's kind of bringing up the subject like what, thinking about these therapists as just human beings out in the world like us. What is therapy like? How do we find a good therapist?
Yeah, I'm thinking of where to start. And I guess, there's so much to... for one thing, we can talk a little bit about like the different perhaps schools of therapy. If we're thinking about like, okay, let's say you're depressed and you want a therapist, where should you start? And I think one of the first things you might encounter are, do I get a psychiatrist? Do I get a psychologist? Do I get a social worker? Do I get a psychoanalyst? Do I get a psychodynamic person? So the first major difference is between psychologist and psychiatrist, I would say. So a psychiatrist is a doctor. They're a medical doctor, the physician. So they've gone to medical school. And their primary differentiating purpose is to prescribe medication. So if you are looking for, if you're looking for an antidepressant, Adderall, if an antipsychotic, something like that, you're going to want a psychiatrist. And so then you might have the question, well, why do I need a psychologist as well? And you might not. You might find a psychiatrist who also does therapy. The problem is that it's becoming less frequent. Many psychiatrists are pretty much only prescribing medication. That's their primary role. And because of the way they receive training, they might be engaging more in kind of older forms of psychotherapy, psychodynamic or psychoanalytic styles, which isn't necessarily a bad thing, but we'll kind of discuss the pros and cons of that. So a psychologist is somebody who cannot prescribe a medication. They can give a referral out. So it might be the case that you see both a psychologist and a psychiatrist, but they'll be doing long-form therapy with you. So you'll be meeting them with 50 to 60-minute sessions. You'll be doing psychotherapy, and then perhaps you'll see a psychiatrist on the side for your medication needs. And a psychologist will have either received a PhD or a PsyD. Major difference is basically a PhD has more of a research focus and a PsyD has more of a clinical focus. Both are totally qualified. They are 6-year programs. They'll be very, very well trained. And they are likely, especially if they are younger therapists, to be trained in the newest empirically backed practices. Probably more likely to be CBT oriented these days, but there are still some psychodynamic schools. Okay, so if you see a social worker or a licensed mental health counselor, they're also qualified to give therapy. They usually have a lower price range. They will have received 2 years of formal schooling and then supervised hours after the fact. So they will be working with the supervisor for probably 2 years to receive this training.
So a lot of patients that I see will be either they've already taken medication, they're already working with a psychiatrist, or they're starting to talk to a psychiatrist or at least thinking about medication. And they go, well, I don't want that. I just want to do therapy. I'm kind of nervous about medication. We're not experts in it. We're trained in the therapy, but this is usually what I say to patients. I just say, consult with a psychiatrist anyway. The research shows that the combination of therapy and medication is very, very strong. So usually that's like the winner, to have a combination of medication that kind of can, like, let's say antidepressants for depression. You kind of picks up the mood, it picks up the energy. And then that energy and motivation usually allows that patient to really take in the therapy better. So, for treatment of depression, we're asking you to do things differently and think differently to make some changes in your life. Well, for some people who are just so depressed that they can barely think, can barely get out of bed, sometimes medication really helps get that motivation back in order to, and lifts up the mood enough to be able to make those changes, right? So I usually say it's better to have a combination. If you get up one, that's amazing. But a psychiatrist is there to really understand what medications they're giving you, and also what seeing the bigger picture. So they're really trained in knowing, okay, this medication might be good for you because you're taking other kind of medications that can interact. So they see the whole picture of your medical profile and prescribe based on that. And I also want to mention that a lot of people get antidepressants or prescription for meds from their general PCP, their general doctors who can do that. But I always say it's better to talk to a psychiatrist because their specialty is learning mental health and how to treat mental health. So I definitely say that if you're taking antidepressants or any kind of medication for a mental health reason, really consult with a psychiatrist.
I think that's an awesome point. I think a lot of people have this maybe perception that psychologists are like anti-medication, or that there's some kind of competition when they get. No way. Yeah. I really strongly advocate for medication if prescribed safely, thoughtfully by a psychiatrist who knows what they're doing. Because exactly as you, and I think it's important to differentiate, like, an antidepressant is not going to solve everything, because it's not going to change your ways of relating to the world necessarily. It's not going to change your partner or your life circumstances or your ways of coping, but it can take down sort of the valence of your emotional response. It can help kind of clear away. I remember when I was talking in the depression episode, it can clear away that smoke monster a little bit, that feeling of like being kind of consumed by fog and darkness, and so you can't even make decisions or think. I think it can be great for anxiety. I mean,
some people say, I think that taking medication, some people have this fear that it really means something's wrong with them, or that they have to take this forever, or it'll change their personality. But it's funny because if we're, diagnosed with some kind of other medical illness, we're going to take the treatment, right? We're going to take the medication. But something about, treatment for depression kind of feels like it's more about our identity. And, there have been many people who have taken these kind of drugs, depending on what it is, but have taken these drugs and are not on it for the rest of their lives. Or, they just take a certain kinds of, drugs that work for them, and they could really live the life, to the fullest capacity. And so we say like the pros and cons. For some people, that's worth it, right?
Yeah. I think the other thing that happens with medication is they take a while. You're not going to take a full dose of Prozac the first day you take it. You have to build up. It takes at least a month. So often it takes 2 months before you're really seeing effects. And that's a really long time to wait if you're, acutely suicidal or something like that. And so there can be a lot of frustration around medication, but generally it's an awesome and totally valid option that I hope is not associated with shame or feeling less than or anything like that, because they help. So, okay, so that's psychiatry. In terms of different schools of thought, so actually, Kibby, why don't you take this?
Yeah, it's interesting because I've been in a couple roles where we've had to triage people to different, usually the process is that people will call a clinic and they'll be evaluated. They'll be set up with an initial intake or an evaluation session. What that usually means is that they talk to a trained clinician for about an hour or so, maybe a little bit more, where they're going to be asked about all of their experiences, their history of mental illness, what they're experiencing now, what other things and symptoms they might not even thought of as being related. So someone gets like a full picture of what they are going through. Even when you first start with a private therapist, usually there's an intake session where they'll ask you what's going on, what do you need help with. And then at the end of that, our job is to try to figure out what kind of therapy is going to be best for them. So there's a big plug for empirically supported treatments. Now we have a lot of research showing that there's certain really kinds of therapy and kinds of therapy techniques that work really well for specific disorders. So it used to be where you just go to any therapist and kind of talk about your problems, but that's not really, we've found that what evidence is that's not always helpful for every single disorder. So even just, this is more anecdotally how we work, is if someone is struggling with like an anxiety disorder, depression, substance abuse, most of the time cognitive behavioral therapies are the way to go. There's a lot of evidence for that, showing that it's super, super effective, and it's really good with like problem-oriented mental illness, right? If you're having panic attacks and you really need to stop the panic attacks in order to live your life, CBT is great for that, right? So if someone has more suicidality or kind of a combination of really severe mental illness, like they have depression, but they also have suicidality, substance abuse, have trouble with relationships, they're going to be referred to dialectical behavior therapy. Most of the time, because DBT, as the acronym is DBT, was really developed for people who have self-harm and suicidality, but super good for people who just have problems managing their emotions, which could come out in all these different ways. Mm-hmm. So you're going to get DBT with those kind of complex issues. And psychodynamic and supportive, usually those are really good with a lot of different things, but I found in my, I'm learning a lot of psychodynamic training now, and it's especially good for really relationship issues, I think. That's just the way I work, but people who are saying like, well, I'm having trouble really understanding my purpose in life, or understanding why I do the things I do in relationships, or it's just kind of this general like, who am I and how am I relating to people? Psychodynamic is great because psychodynamic really takes into account your early childhood experiences. So your relationship with your parents, your relationship with your family, how you grew up, and how that plays into your symptoms now. So
Yeah, so basically the big two camps you're likely to see are CBTs versus psychodynamic therapy. And the way this kind of happened was you have Freud, who everyone's probably heard of, big old school guy with a beard, very obsessed with sex and dreams and all that good stuff. And from him, we had the psychoanalytic tradition where people would lay on a couch and they would just sort of freely associate. So they just talk and talk and talk, and then you'd have the psychotherapist who's sort of sitting there writing notes. They're not making eye contact necessarily. They're doing a lot of interpretation. And psychodynamic was a modernization of this. So they looked a lot at childhood, at early attachment experiences, and how that influences people today. And a lot of it was sort of based off of bringing what is maybe unconscious, so in implicit memory, those things that we don't necessarily explicitly remember, but they're just kind of in us, these memories, these experiences that we have that sort of settled into our body and influence the way we act, kind of uncovering those and realizing how we act today might be a reflection of what's happened to us in the past and in those early experiences and attachment experiences.
Yeah, and I'm learning it now. Actually, like I learned CBT in our grad school, and now I'm learning more psychodynamic now, psychoanalytic traditions. It's interesting because it rests on you really want to bring. This is what this therapy is all about. It's really about bringing all of those things, those unconscious drives and conflicts, into the therapy itself, and it's really focused on the therapeutic relationship. That is why psychoanalysts will see a patient 4 times a week, 5 times a week, because you really want to make that relationship real for that person. And then they bring all of their issues, right, in the therapy room. So that probably people have heard of transference and countertransference. A lot of what psychodynamic, psychoanalytic therapists will do is really understand what's happening in the relationship. How am I reacting to this patient? How is that patient reacting to me? And if the therapist is really almost kind of non-person, like a blank slate, like they don't say that much, it leaves more room for the patient to bring in their stuff, right? So, for example, if they get really angry at a therapist for seeming very demanding and aggressive, well, then you're going to really look at like who in that person's life was demanding and aggressive, right? Maybe it's someone from their childhood, and you could talk about how that patient might be bringing that lens, bringing that the past experiences into their present. They also do that with free association. So psychodynamic therapy will be very open-ended. The patient kind of drives the conversation. You go where they go, right? That's kind of a method to try to get those unconscious thoughts and conflicts up to the surface if they're just allowed to freely speak. So,
yeah. I mean, I'll just say anecdotally, like, I've always had a lot of reverence for psychodynamic therapy because my mom is psychodynamic, my boss was psychodynamic, Esther Perel is psychodynamic, like all these people I really look up to. My experience with psychodynamic therapy has been that I've talked a lot and the therapist hasn't really given me a lot back. And so that might be something that it's experienced where you're just like, why am I spending all this money to just talk and talk and talk and I'm not getting a lot back?
Yeah, I think this is for every kind of therapy though. All of these thoughts you might have about the therapy, I think patients should bring it into the therapy. They should talk to their therapist about it because that's actually the meat of the therapy. Yeah. If you're nervous, if you feel like you're not being understood, if you feel scared or angry at the therapist, all of that is the therapy. So a lot of people actually hide that. They're like, oh, I don't like my therapist that much. I don't think he's listening. Maybe I'll just quit. And it's just so funny that is actually, that would create the most change in the relationship, in the treatment, if they came in and say, hey, therapist, I feel like you aren't listening. And you could talk about why, and you could talk about what things the therapist did or didn't do to make them feel misunderstood. Is that happening in their current life with the other relationships, right? So that's like a hugely important thing to bring in all those thoughts about the therapist to the therapist.
Yeah. I want to come back to that because I think it's a really important discussion. Let's just go over CBTs real quick. So CBTs, I mean, I think what's going to become kind of funny to Kibby and me is that there's so much overlap between these schools of thought. They pretend like they're in giant competition, but then once you start learning about them, they're like, oh, There's so much that's the same. We know that things from psychodynamic therapy have worked. We know that there are all these factors similar. And so CBTs have put a giant emphasis on science. So they really dive into like research that backs the hypotheses. And so if there's a possible intervention, if there's something hypothesized there, then there will likely have been a study that shows this intervention works for this particular condition. Kibby, what else would you say?
So the CBTs were started by this man, Aaron Beck, who's like an amazing therapist. I've seen him in a workshop. He's very sweet, actually, very like a great, great, gentle, understanding therapist. And he, long story short, he basically was like, he was trained in psychoanalytic theory, like a psychoanalysis, like everyone was at the time. But he was more like, how do we know that someone's getting better? Like, how do we know? How do I know I'm doing a good job? How do I know? And the psychoanalysts were, kind of brushed that off. And so he emphasized, okay, how can we really measure and come into agreement with me and my patient that that person is getting better? So there's a lot more emphasis on measuring something objectively, right? Like bringing in scales, bringing in measures of depression, bringing in goals, and really almost kind of more like a problem-solving approach where just like you and I are collaborating to really get you to where you need to go to achieve your goals. And in CBT is very structured in that way. You start out by talking about your treatment goals. What would you want to see change or different in your life? Would you want to be happier? Do you want to exercise more? Do you want to have more friends? Do you want to be able to go to work and function without your symptoms, right? So you kind of collaboratively define the goals. And then in a very structured way, you have an agenda where every session you talk about what you're going to work on that day. You have home practice or homework where you might talk about, what changes you're going to make, but CBT really emphasizes making those changes in your daily life. Mm-hmm. So it's very active. It's very like change oriented.
Yeah. And CBTs is a big umbrella term. That's what our advisor has pounded into our heads, is that there's no one CBT. It's a whole bunch of interventions. So you've heard us talk about DBT and what else we've talked about. Mindfulness. There's a whole mindfulness-based therapy. There are all sorts of different interventions within the CBT's umbrella that work for different problems or disorders. And we're going to start now talking about like what the therapy session is like, what questions come up, what it's like to be the therapist, and we'll probably focus on CBTs because that's our major area. So first of all, what is a session like? So I would say it depends on the therapist, but it can range from, you show up and they ask you to do a lot of questionnaires and measures, and they get demographic information. It can be more of like an interview style, or you might show up and you work really collaboratively about discovering your therapeutic goal together. Kibby, what else would you say?
Yeah, it depends. If you're doing a CBT kind of therapy, therapists usually start out by saying, what's on our agenda, right? They say it in different ways, but you basically kind of figure out what you're going to talk about in that session. It could be we're doing this particular exercise, or we're going to do psychoeducation and learn about what you're going through. But at least you figure out in the beginning what you're going to work on. And then really in CBT, the whole thing is like thoughts, behaviors, and emotions all interact. They all work together, right, as a big system. So you pick one part of that you can work on. Usually it's behaviors or cognitions, which is thoughts. Mm. And you might really gain insight on what's happening by understanding, okay, here's my problem. I am depressed and I didn't go to work today. And so you really write out and work with the therapist on identifying what thoughts you had that led to your problem behavior. What did you do, the behaviors, what did you feel, right? To really kind of get this very nuanced, specific picture of like, what are your thoughts, feelings, and behaviors within your mental health problem. And then at the end of the session, the therapist and you kind of come up with a homework assignment or home practice where you go home and between sessions, you're really working on something, right? If you're working on thoughts, you're really like noticing and paying attention to your thoughts and what your thoughts lead you to do, right? Like the thoughts of I'm going to be a failure might make you not want to get out of bed, might make you not want to go to work, right? And so your therapist and you might work on that thought, I'm a failure, and try to change that thought to be a little bit more accurate or more helpful. So that's what a CBT session would look like. Yeah.
Yeah. That's not necessarily the first session, but that is sort of any given CBT session. Yeah. So why don't we go into some questions from listeners to kind of guide us? So the first very basic question is where to even start with choosing a therapist and best approach to finding the right fit or ways to minimize the shopping around.
I think that number one, getting educated on what you're experiencing is really helpful. So people do this anyway, right? People kind of Google, like, I'm having a panic attack or whatever. And even just having that idea of what you want help with can help. And unfortunately, I know that people, when they're in high distress, don't want to do this, but I think the number one thing that's important is to shop around for a therapist or clinic that works for you. People often just start seeing a therapist that has a first availability. If it's really about fit, I say this over and over, it's really about fit between you and the therapist, right? First, make sure that they're trained in the thing that you're looking for, right? If you're looking for help with anxiety, check out to see what their background is, what they've been trained in, if they're trained with anxiety disorders. And you could go ahead and ask them, right? The first few sessions with a therapist, you're just getting to know them and seeing if it's a good fit. You don't have to dive in and commit. You can talk to that person about, here's what I'm going through. Do you have training in that? And also, it's like a personal fit. If you like that person and feel comfortable with them, that's great. That's going to do a lot of the good work for you. If you don't feel comfortable, it's okay to talk to other therapists and see if the fit's better.
Okay, so I just want to put a real quick caveat to this. So I was talking to my brother, who you may remember from the social anxiety disorder episode, about his fears about getting a therapist right before this. And he was like, I would want to find someone who is not intimidating. So someone who I think, he's probably not going to like me for saying this, but someone who's like maybe not very good looking or maybe a little dorky or something like this. I know. And so, but I think it's such an interesting point is that a lot of times the therapist that we might gravitate towards might illustrate some of our own fears and avoidance. Yeah. So, he has social anxiety disorder. So it doesn't totally surprise me that he's looking for someone, because he already struggles to express his deepest thoughts and to connect deeply. And so finding someone who he's not intimidated by would be comforting to him, because he's like, well, you're probably not going to judge me as much. So all of that, the reason I bring that up is I think chemistry is so important, and the person who makes you comfortable is so important. But when does that go a little bit too far?
That's a really good question, because I know that's come up when we're talking about the Taylor Nolan stuff, and where there's a lot of concern. And I totally get this. Like, if you are looking for a therapist, and some people are looking for people who can really relate to your own personal experiences. For example, a lot of people look for therapists of the same race as they are, or same gender, age, life experience, right? Because a lot of people are thinking, oh my gosh, I'm going to tell my most vulnerable, maybe shameful secrets to somebody. I want them to be able to understand. And that's hard to do, especially if you're in a place where they don't have a lot of therapists that the kind of therapist you're looking for. But that's hard to say, because, that's almost kind of judging a therapist by its cover. Mm-hmm. Therapists who may be of a different race, different age, gender, blah, 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 they might be able to really be understanding and compassionate to your experiences anyway, right? And so, giving people a chance, giving therapists a chance, and knowing that well-trained therapists, wherever their background is, whoever they are, they're trained to really understand people's experiences, even if they don't experience them themselves. And yeah. Mm-hmm.
Well, for one thing, we have to, right? It's not like everybody who sees us, it's not like we can have experienced everything that our patients experience. We can't BPD and schizophrenia and be a different race and have grown up poor and have grown up rich and be 60 years old and be 20 years old. You know what I mean? It's just not. So no matter what, there are going to be differences. And what I think is important also is that it might really benefit my brother to have a therapist who is intimidating to him, because that could challenge his sort of automatic thought that someone who intimidates me couldn't understand me, or I can't trust someone who intimidates me, or the only person I can trust is somebody that I think I can be better than, or something like that. So a lot of times the very thing we're afraid of actually could be really beneficial in therapy.
Totally. I even think that I've had great therapeutic relationships with people who are a totally different background to me, because then I get curious. Then I want to ask them more about it. Whereas people who have the same background as I do, like some patients I have who are Chinese or from Asian descent, I jump in thinking that I know more about their experience. I probably do, right? Like I go in making assumptions based on like, oh, we're the same, we must have had the same experience. I actually think that does it a disservice, because I'm less curious about that and I'm, quicker to make that assumption. So sometimes like people who are very, very different to me, it leaves that openness for having that conversation about race, of culture, religion, things like that.
Yeah, 100%. I have a couple of patients I can think of, and the things they describe, I'm like, yeah, I do that too. So I can totally describe it. I know exactly what you're going through. It's like I have to stop myself and say, no, they're going through something similar, but they're a different person. Their process is different. And I may think I know exactly what they're going through, but I really don't. And I need to be as open and curious as I would be with any other patient. So,
I mean, this could go into a little bit about, just the idea that we're human beings, right? And how can we, there's part of this relationship where we're almost like a non-human, either like a maternal figure or just someone outside, someone seen as wise and things like that. And of course, there's always this benefit to having a third-party perspective on your own experience. So someone else can kind of give you a perspective that you don't have. So even just talking to someone's helpful. But we are human. Like there's times where I'm tired and there's times when I'm crabby that day, and all these kind of things that you were talking about in the beginning of how can someone feel comfortable when, there are times that we're off. Or I always actually say that my patients come in and sometimes they ask me, I just want you to like me. I just hope that you like me and understand me. And I actually say, no, I hope I don't, because if there's a conflict or, we're mad at each other, I'm irritated, that's really useful information for therapy. Sometimes the people I've had the best therapeutic relationships are people that I didn't necessarily feel super good at first, because you could really, butt heads and then talk about it and learn how to resolve conflicts together. So there could be a really rich therapeutic relationship, even when the person, isn't exactly like you, or you don't like them, or things like that.
Yeah, so that brings up the question, basically, are we secretly judging our patients? And I think there's just so many different ways to answer this. I mean, the first answer is that this is a profession of human beings, and every therapist is different. And there are going to be some therapists who judge their clients, and I don't know how to get around that. And also, what we mean by judgment is really important, because, one follower asked, do you judge the appearance of your clients? And it's like, well, yeah, we do, because that's important information. We have to, in a sense, keep an eye out for how is the world looking at you? What are they seeing? If you're dressed in, if you're dressed in sweatpants, you're not washing your hair, you're really down, I might see you as someone who might be really depressed, who doesn't have the energy or the focus to take that extra step and make yourself look differently that day. If you're dressed in really wacky, expressive clothes, then, I'm going to keep an eye out for, well, how are the other people in your life seeing you? How are your bosses seeing you when you look this way? But that's not the same as, ew. Like,
I think what
yeah.
you're trying to say is a really important point that people should keep in mind about therapists. Our job and all of our training has led us to do this function, but our job is to be on your side, is to help you live the best life that you want based on your treatment goals. So we are, everything we think, everything we're going to say, you know, we might consult with colleagues about this, consult with supervisors, consult with literature. We're here to figure out how to help you. So even if I have a judgment of, oh, that person, you know, doesn't look like they've washed themselves or tattered clothes, you know, like it's going to matter if that person, if that person's like going for job interviews like that. And my way of helping them is like, hey, you know, maybe there's other ways you would like to project yourself. But if that's not a treatment goal, if they're, you know, hey, this is a pandemic, like as we're talking about that's exactly what I look like right now. And if that's fine with them, then it's great. So we're really here to help our clients. We're not here to judge negatively and almost like, you know what I mean? Like the condescending tone. There's some therapists I'm sure are like that, but the well-trained ones won't. They're in your camp.
Right. I mean, I said this in the video, I've said this before, but like the kind of judging that I think we saw in the tweets is so uninteresting, because what it does is it shuts down any possibility of authenticity, of like getting to know the other person. And that's not just so that I can help another person, that's so I can help myself, that's so I can learn more about the fascinating world that we live in. Like, if I spend my time being like, ew, your teeth, or ew, like what you did was so bad and immoral and then like I'm shutting you down. I'm putting a giant wall between myself and the truth. Like, I'm never then going to understand how another person could have gotten to this outcome. I'm never going to understand how, like, all of these things that people do ultimately make sense and have an explanation and are all tied in this big, complicated, amazing web of, like, how we're brought up and how we learn to understand ourselves and how we feel about the rest of the world. And it's such an amazing privilege and honor if somebody is like, I'm afraid to tell you this, but this is actually what I think. This is actually what I did. This is actually how I react. Because, I don't know, I mean, from my experience so far, it's been like, shit, I recognize that. Or like, I've thought that before. I haven't maybe admitted it. Like, you just awoke something in me. Or it's like, that's so interesting. I never thought of that before. That's a new connection that I get to make. And like, now I can use that and help other people. And if you spend time judging, it's like, what's the point of being in this profession in the first place? It's just...
Yeah, no, I think you hit it on the head that, you know, a lot of therapists get into this job because they're interested in people, right? They want to let you in and let your experiences in. Now, I do have to say that that's really intense. At least for me, I'm more of like a high emotional empathy kind of therapist, which means that I really like to be in tune with emotions, and I like take it into my body a lot. And it's pretty intense. Like, I had to develop ways to leave, you know, the patient in the room, so to speak, which is like, I'm sometimes left with the intensity of the emotional impact of what we talked about or what the person was feeling. And I had to develop, part of my training was to figure out ways to process that emotion. Like, I would go to exercise. I would go to my spin classes right after certain patients and really just like work out that feeling. But therapy's so amazing. I just love it so much.
No, I think that's a cool point though. I mean, it's like another person asked, do you take this home with you at night? And I mean, I think it depends on the patient. It depends on the therapist. Like, I'm higher cognitive empathy. I mean, I don't mean that I have higher cognitive empathy than you and that you have higher affect empathy than me, but I tend more towards cognitive empathy. You tend maybe towards affect empathy or something. And so you might take it home a bit more than I do. But also, I'm a junior therapist. I just started. I don't have cases that are, you know, high trauma and, you know, so I don't know. So I guess I'll see. But
I'm curious if you've experienced this. I've always felt this in my practice where when a patient talks about a feeling or memory that's emotionally latent that they haven't talked about before, like I've never told somebody about this before, and they might have told me about like a trauma or another feeling, I feel that emotion so much more strongly than when I listen to people talk about things that they've like talked about many times before. Have you ever experienced that where you just like you're like, whoa, it just feels like, well, you've mostly done this on Zoom, but in the room it's like, whew, you might feel it super strongly.
Yeah. Well, it's just, I mean, well, they've never articulated it before, so it's not a script that they're reading. I know what it's like to be rehearsing a script. I've said the same things a million times over before. But when you say something for the first time, there's such a vulnerability there. And it's such an honor to be the person, you know? I don't, you know, sometimes it's like, are you telling me this because I'm your therapist or because I've really earned it? And that's another thing I would say is, you know, a lot of these people in my DMs and after the tweets are like, well, how do I trust a therapist? And I'm like, you don't right off the bat necessarily, unless you're comfortable with trusting people off the bat, and that's valid too. But like, we don't get to just hear your most painful and vulnerable and scary parts of yourself just because we're therapists. Like, we are there to earn your trust, and you can take your time.
That's an awesome point. I think people feel very scared to come into therapy. A lot of them, especially who have had trauma, and they're like, oh, do I have to talk about it right now? And, you know, as you said, it's okay to take your time. It's okay to say to the therapist, like, I'm not ready to talk about XYZ. And the therapist might ask you about that, like the feelings around that, but a good therapist should respect your boundaries and respect your space. They shouldn't force you to do anything you don't want to do. With medicine, therapy, all kinds of your own treatment, you are in charge. You could say no. You could say this therapy isn't working for me. You could say, I don't want to talk about this yet. Can we talk about it in a little bit, right? So
yeah, I think one thing that happens is that the patient doesn't realize how much power they have, but ultimately they're paying for the therapy. Like, we're there to service them. And there are going to be times when we feel it's necessary to maybe push them a little bit. But like, we can explain that, you know, you don't have to just buy into that blindly. Like, if you're uncomfortable, like, I think it becomes difficult because it's like they're paying for therapy, they're investing in us, but we have this kind of authoritative position over them that it can make it really confusing. Like, and that leads to a lot of guilt about telling the therapist what's wrong, telling the therapist that they don't think that they're getting much out of the sessions, or that they feel judged, or that whatever the case may be. And I also get that that's uncomfortable because sometimes, like, if you're seeking therapy, maybe it's for social anxiety disorder, and then you wind up having to tell the therapist, I don't think this is working for me. Then it's like you're doing even more work, when I think patients expect therapy to be this soothing process, and it's not always soothing.
Yeah. I think the best therapy is actually, you know, you don't always feel good. If you feel good after every single session and in every single session, you might not be talking about the things you need to, right? Like, if the therapist is there and saying, you're amazing, you're great, everything you do is right, that's correct, then, you know, I don't know. Like, I wouldn't say that's a terrible therapist, because they might be right, but, you know, they should push you sometimes.
Yeah. I like this question. Someone said, I'm concerned they won't have sympathy for me dealing with the consequences of my mistakes.
That's definitely part of our training. That's part of our job. I think kind of actually what, you know, to the point of not having a therapist just be your cheerleader. A lot of the time, we help our patients process the actual consequences to their actions, right? So sometimes they did something that really hurt others, or really hurt their relationships, or cost them a job, or anything like that. And it's a process of learning from those experiences. So with a therapist, it's okay to, you know, to sit and be like, ooh, I screwed up. Yeah. Why did I screw up? How did I screw up? What can I learn from that and to not do it again, right? That's all part of therapy too.
Well, I also think, I mean, I would never have a patient where I just assume that all of their pain is caused by other people. I mean, we kind of go in being like, okay, well, you know, what is it about you? Non-judgmentally, but this is how humans work. We all contribute to our own pain. And maybe we contribute to our own pain in ways that made a whole lot of sense before. Now they don't. So, in other words, I just expect people to come in and talk to me about pain of their own making, in a way, because that's just part of the human.
And that's what we can do, right? There's a lot of people who come in and they say, my problem is other people. And we say, like, we can't change those other people. We can only work with what you have control over, which is how you're responding to things, what you're putting out, how you're thinking about it. So you could only work with your client. You can't make their husband or wife or friend not be such an asshole, right?
Well, I mean, the irony of this question is that if they already know that they are dealing with the consequences of their own mistakes, then like you're one step closer.
Yeah.
Great.
Yeah. That's actually way more insight than a lot of people have at first.
Okay.
Yeah, that's another tip. If you want to talk to a therapist about how everyone is doing you wrong or being a jerk, think about that, because if you have a problem with every single person in your life,
yeah,
your friend.
Do therapists social media stalk their patients?
I don't.
I mean, some do, you know, but it's bad practice.
Yeah, what do they talk about that in the program these days? Because it's every year that social media is so much more of a thing in therapy. It's such an interesting ethical.
My postdoc told me not to tell me about it because we're supposed to really be getting we're supposed to be working with what that person is trying to show us. We're not supposed to be finding our own information about them that also is skewed. Mm-hmm. So it's just kind of a bad idea. Okay. Do you ever talk to your significant other about clients or another confidant that's not in the field?
That's also our training. We're not supposed to. However, sometimes we do, but we know how to do it to protect people's privacy. That's a really big part. You're not supposed to, right? But that's why we have those supervision groups where we have, a trained therapist, a licensed therapist, and it's like a really safe space to talk about our patients there.
Yeah.
However, we're human, so sometimes I'll come home with those emotions, and I'll know how to explain it to someone, like a significant other, that doesn't give away any.
Right. It's not like John Smith told me that today
I'll be like, a patient just, like talked about how they were hurt by someone, and it just like, I'm so furious on their behalf. I'll kind of talk about like the emotional part that I'm working with, but I won't say anything that would give it away and who that person is.
There are also themes that are just like exciting, like if we just hit upon something, like, yeah, I might be talking to Paul and I'm like, oh my God, the most exciting insight I had today. And then you can describe that, but just in an abstracted way. You're not giving away you're not telling the story of a single client throughout time and especially no identifying information. Okay. Can a therapist dislike you personally and still help you professionally? I feel like you've answered this, but I think that's a cool question because sometimes that's the best help you can get because the therapist, knows what is going wrong in this person's life sometimes.
Personally, I mean, I since I love working with people with interpersonal difficulties, most of these patients I work with, there's a part of me that's like, God, you're kind of a jerk in this way. And the thing is that I love those patients and I am a genuine kind of therapist. I tell them, but I tell them in a way that I'm on their side. Like, dude, when you say, when you complain about this person like that, it makes me really frustrated. Let's talk about that. Or, like there might be just quirks or eccentricities that, we could talk about openly. And no, I like those kind of people though. So,
what would you say are provider red flags? And how do you so this is a multi-part question. One person asked, how many sessions should it take to know if it's a good fit? What are some red flags?
Yeah, wow, that's a really good. Most therapists and clinics will have a kind of consultation. Like a lot of private therapists will have a consultation where you talk to them on the phone, or you have a first session where you just get to know them. It's totally okay to be like, this is not a good fit, right? After that. Therapists are very used to that. They're totally okay with that. In other clinics, like kind of the ones that we were brought up in our group, it's like we'll say the first couple sessions are a time to get to know each other. There's no magic answer. I think we arbitrarily say 4 sessions. You kind of get a feeling of someone, but you should get a feeling that that person is at least someone who you can feel comfortable enough sharing some stuff, right? I mean, especially if you have social anxiety, that might be harder. But if you feel like you really, really can't open up with this person, that's not a good fit. And that could be from like minute 5 to like session 4, but it's okay to like communicate that to the therapist.
Yeah, I mean, I guess the best thing to do is if you have doubts, communicate those doubts. And I know that is hard because I've failed to do that myself. So I get it. But that's just a good tip.
Let's see. So red flags, I would say that one of our very important ethical guidelines, I mean, it's like kind of a rule, is that we're not allowed to have any kind of sexual or personal relationship with with your clients.
It would be a very red flag.
Yeah, exactly. But, really keep that in mind. If someone is touching you inappropriately, and I have heard of that, actually, like inappropriate hugs or massages or anything like that, or if they offer to have some kind of personal relationship, like they meet you for coffee or you go on a date, especially if you're working with them, that's a huge, huge red flag. Many of them do that, and if you have a good relationship and you trust them, okay, I hesitate to say that, but sexual relationships are definitely off the table. So I think that's the number one.
And very reportable.
Yeah.
Yeah. I mean, therapy sessions should not be very touchy-feely. I mean, what would you say, even if the patient is crying? Would you go over there and hold them? Would it be dependent on the relationship? I mean...
It's tough. That's one of the things that we talked about in our training is, sometimes that is like the most natural way to comfort and be there with someone. But it's also hard because you're not supposed to touch your patients because there might be some misunderstandings and crossing of boundaries. Really, really hard. Our guideline is like, no, but if you have if you've worked with someone for a while, you really have their trust, you're able to talk about it and, really set those boundaries clearly. Like, is it okay if I give you a hug now? Or, if you've known the patient for like several years and, then sometimes we're just human and we just want to care for our patients the best way we can. So tricky though. It's tricky.
I think another really interesting thing to think about is small town therapists versus big city therapists, because that's going to raise a bunch of conflict of interest difficulties.
Yeah.
So in a small town, there might be very few therapists, and so they might naturally be doing things like seeing multiple patients who know each other. Maybe even married couples, seeing them separately. And these things would be giant red flags to me in a big city. Unless it's just sort of complete happenstance, that two people who know each other go to the same therapist.
Yeah. I mean, as a guideline, if you can, the best practice is to see a therapist who's not seeing any of your loved ones or family members or friends, right? You really want them to be a third party. Of course, in those small towns, that might be hard. However, I think that telehealth might have changed things. I don't know how much is going to last after COVID, but a lot of therapists are doing therapy by Zoom or other kind of virtual platforms. That might open up to, you could find a therapist who does telehealth in your state.
Yeah.
I'm not.
Yeah. Okay. This is a good one. Do therapists judge us for taking a long time to get it? I legit worry I'm bad at therapy.
Oh.
I know. I like
That's
that one.
sweet. No, I mean, I sometimes... Okay, I said, okay, let me go back.
I feel like I have some experience with this. It's not so much that I'm judging the person, but it's like, I'm almost judging myself, like, are we a right fit?
Mm-hmm.
Am I really being truly beneficial? How long should I... But that's me as a junior therapist, so...
Yeah. I think I'm used to thinking change as a spiral going upward. Like, one of my supervisors kind of gave me that picture. We, as human beings, make mistakes over and over again, right? That's why we're coming into therapy. We date the same kind of person, and it ends up the same way, and we do it over and over. And it might take a really long time for it to change. Some problems change, within a couple sessions. Some take years. The ones that are like more ingrained from childhood often take longer because it's like really deep learning. But, even in therapy, when you're you might be doing the same thing over and over, but maybe there's some changes in that loop, right? It's like maybe you think of it slightly differently. Maybe you'll try something reacting in a slightly different way. Maybe you'll have more awareness when you start to do it. So at least there's like some kind of change in the way you approach it, and that might take, as long as it needs to take. But sometimes it's a long change process. So
I think it's also like, if this were easy, we would all be out of jobs. Like, if we in a few sessions could just fix your problems, like a robot could do that, so we go in with the expectation that it's gonna be a while, it's gonna be challenging, and that everyone's gonna be different. I have 2 final questions. So the first question is basically like, what rules govern our behavior to make sure, for instance, that we do not tweet about our clients? With the rules of confidentiality, what rules protect, even if you go to a bad therapist, even if you have a totally shitty person as a therapist, how are you still protected?
That's a trickier question than you think, actually, because state by state, there's a American Psychological Association as a accrediting board, and they give out guidelines about how we should behave professionally. There's also state laws. So it's actually that's actually quite complex, but we have ethical codes that we all try to abide by, like no sexual relationship with patients, basically like support them and do no harm, right? So there's ethical guidelines, but there's also legal ones. So that's a really...
But no therapist could go on Twitter and say, listen to what John Smith said to me today.
No. Yeah, especially HIPAA, which is you basically can't share personal information or identifying information with anybody. Like the privacy is a really big code for us. So most of our training is about keeping people's privacy and confidentiality. So we can't tweet about people. We can't post anything on the internet about people, especially if it has identifying information.
And when we do have to break confidentiality, it's because we think that there is good evidence that that person will hurt themselves or others, or that a child or an elderly adult is being abused or neglected, or if a court subpoenas our records. Yeah,
and in those situations, we say that people's safety is number one priority. So I, in those situations, like to work collaboratively with my patients to say, I think, I'm kind of worried about your safety. Can we contact someone else about this, and can I let them know that you might need more help, or you need to go to the hospital or something like that? So
yeah. Okay, so one question I just think is personal for us because we study personality disorders, but there was a tweet that was very, very negative and offensive towards people with personality disorders, and I had one person ask, do therapists really feel that way?
No, people with personality disorders, we know that they're struggling, right? We know that if you have a personality disorder, which means that you have difficulty with your relationships and functioning like throughout your life, we know those people have suffered for a really long time, and they deserve happiness. They deserve love. That's why we got into what we're doing. So even people who have done really hurtful things to others, they still need help.
Yeah. There are going to be some therapists that are maybe not really qualified to treat people with personality disorders. So I might caution against that. I'd go for an experienced therapist, a therapist who might have experience with DBT. But no, we have a lot of compassion and love for you all, and absolutely do not stand by that message. Okay, well, Kibby, any final send-off?
So there's no specific resources, but I would say that anyone listening has more questions or want us to follow up on anything, please shout out to Jacqueline on Instagram.
Yeah. Thank you all for listening. Thank you so much for submitting your questions. I was really happy to do this episode, and it meant a lot to see people were afraid of seeking therapy, and that really made me concerned and sad. So we just wanted to talk to you all about it. Oh, and my Instagram handle is @Trumbellina, and my name is spelled like Trumbull, like the bull, and then INA. Okay, we will see you next week. Thanks so much. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval